decided that with the enactment of the Earned Sick Time Act, the ESTA Act, childcare providers, which is already a challenging business, would further be challenged by finding help when they have to give time off to their staff. So we decided we would look into establishing a substitute pool. Well, guess what? That's pretty challenging. Oh boy, yep. So we surveyed, we identified strategies, and we learned some lessons. And I think the number one lesson we learned was the root cause of childcare is staffing, and beyond substitute pools, just general staffing was always a challenge. So we kind of pivoted back and started focusing on that. And we decided that there's different aspects you can go into. There's tax credits, there's different things that we could engage in, but we decided to focus some of our efforts on, and I'm going to let Miranda talk about that.
So yes, again, a lot we learned, and one of the little models that we kind of came up with is when childcare works, families can too. What we also found out is a lot of the staffing shortage has to do with what we think a childcare provider is and what they really are. They are teaching our children, they are developing our children, they are professionals, and they should be compensated as such. So when we look at staffing shortages, a lot of it has to do with the wages that these childcare providers are earning. It also has to do with the families and the cost that it costs to send your child to childcare. So it's a double-edged sword here that we're dealing with. So again, substitute pool, awesome, not there yet. I'm going to pass this over to Katrina here.
Katrina, tell them what TriShare.
You as an employer pay 1/3. The staff employee only pays 1/3, and the state will pay the other third for those who are overqualified for DHHS. Out of all these employers, we only have 98 kids in Muskegon County that's taking advantage of this. Something is wrong.
So that means if you're paying $9 an hour, you only pay $3. The employer pays $3, and the state will pay $3. So it's a 3-share. It's based on Access Health model.
As you know, most of you know I do TriShare, and because of Goodwill, we created this great model, and it's now going statewide. So with it going statewide, yes, it's gone statewide, and they are modeling a lot after the way I created it. But guess what? We want money to come to our communities. You all are sending money back to the state, and soon we probably won't be able to participate because we only have 27 employers. What happened to y'all? You're dropping off. So I need you all to contact me so you can sign back up for TriShare. We only have 27 employers in this county that's participating. That's a little bit way too low. So you can contact me at Goodwill, and I will get you signed up so your employees can take advantage. And they just raised the federal poverty level to 400%. So there's no more excuses, employers, not to participate.
Great job to all the teams for what they were able to achieve in mere 100 days, and thank you for their ongoing efforts. Do you have what it takes to improve livability in Muskegon? Visit livabilitylab.com to learn more and connect with us.